The other aspect of predictive models is not looking at interventions, but trying to predict who's at risk. Because often you might come to the positive conclusion that someone is not at huge risk and it's leave well enough alone. Figuring out who needs what is a hard problem, particularly going forward where everyone is properly concerned about the cost of health care. We don't want to spend a lot of money on expensive interventions that are unlikely to be helpful or maybe even harmful. Yet we don't want to fail to intervene when an intervention would make a big difference. So one of the things we want to do is predict who is at risk if you don't treat them aggressively, who is not at such risk, and they're probably better off if you just back off. One of the markets we're very optimistic about is the payer market. Healthcare is not just a medical problem, it's an economic problem in this country, in the world. We have to do a better job of getting more bang for the buck from our healthcare dollar. And we have to do that not by shortchanging people in medical care, but by matching people with care. That's a lot of what our models do. They predict who will benefit from a particular intervention. So you can imagine if you're a pharmaceutical company, that's useful in targeting drugs. You can imagine that if you're a healthcare provider, it's useful in choosing treatments. You can imagine if you're a healthcare payer, it's useful in deciding what you should pay for and what you shouldn't pay for. Where should you go for your medical treatment? Where will you benefit? Where won't you benefit? We often tend to think that the best place to go is the high-end academic medical center. And that is for some people. But for others, it's not the best place to go. Other people will actually do better in a community hospital. So one of the issues we have to look at is how complicated is an outcome likely to be. Is this going to be a routine surgery, or is this going to be a surgery with a high probability of a complication? That should dictate where you go for the surgery. The notion of a high-risk pregnancy is well defined. And those mothers go to give birth at medical centers that can deal with a crisis, with a baby who, say, comes out underweight. And that's the right thing to do. But it's not the right place for every mother to go to deliver her baby. And so figuring these things out is complicated. We don't do it for pregnancy, that's sort of already understood, but we do it for things where it's not understood. Various kinds of surgeries, various kinds of other medical interventions. And we're hoping that we can forge partnerships with payers and providers that will allow them to make better decisions that will simultaneously save money and improve outcomes for the patient population.